Hi, this is Julie Veenstra, and I'm a wellness educator, and I'm here with Martha Wilmore, who's been a wellness educator for over 35 years, and she's going to share with us some information about magnesium. So now, a few years back, I was dealing with a lot of muscle twitches, and it turns out that I was lacking water at the time, but I was also lacking magnesium. And many people are told to take calcium, but it seems lately that more and more people are lacking magnesium as well. Even though there might be some in a calcium supplement that they're taking, there still seems to be quite a deficiency going on just with magnesium. So, Martha, what does magnesium do for us, and what are some signs that people should look for if they're low in magnesium?
Okay, so magnesium is the fourth most abundant mineral in the body, and it is essential to maintain optimal amounts to experience better health in many systems of the body. And it's involved in over 300 metabolic processes, and so it is required for the body to hum and to not experience the twitches that you were experiencing, because obviously we have a lot of muscles in the body, and your body was giving you it was screaming at you and saying, I need some magnesium, along with water, of course. So what I usually tell people to do is to take the appropriate amount of calcium, but if they're experiencing problems, they may not be getting enough magnesium in the supplement they're taking, and they may need to add some extra magnesium because the soil is so deficient today in magnesium. In fact, people who have done stats on this sort of a thing, they say that 80% of North Americans are suffering from the lack of magnesium due to the soil devitalization, or perhaps just an inadequate diet, or if they have high blood sugar, that can affect their magnesium level. Also, if they have digestive disorders like IBS or Crohn's or colitis or celiac, that can cause them, because they're going to the bathroom more often, they can be getting rid of too much magnesium. And then, of course, excessive alcohol and coffee consumption will flush magnesium out of the body as well. So there's a lot of reasons why people are deficient. But then some of the symptoms of deficiency, I'm just going to read a list here. A lot of people will experience high blood pressure, heart arrhythmia problems, muscle cramps and twitches like you were experiencing. Some people will actually have a heart attack because the lack of magnesium will cause the blood vessels to become spastic and they'll twist, and that is dangerous. People will experience anxiety, agitation, constipation is a very common thing due to lack of magnesium, and fatigue, headaches, and glaucoma even, because glaucoma represents extra pressure in the eye, and magnesium helps to relax that. So there's a lot of things. That's just a short list, but it might have seemed long, but that's a short list.
Okay. So now if someone gets too much magnesium, we know that it can cause loose stools. So, you and I, we both love looking at blood work so that we can get a clear picture of what the body needs. And we aren't just guessing at how much vitamin D or magnesium or calcium a person needs. We like to know exactly, what is the blood showing us. So if people are having the blood work done, what level do you recommend that they try to get their magnesium at?
Whatever the reference range is that shows up on the blood work, you always want to be at the very top end or even a little bit over, because that reference range is based on averages. And since 80% of North Americans are low in magnesium, that reference range is going to be a little on the low side. So right at the very top or a little bit over what the reference range says.
Okay, so to get more magnesium, people can eat things like spinach, dark leafy greens are high in magnesium, quinoa, almonds, raw almonds, not heated, cashews, black beans. But we know that it's also very hard to get enough calories to get the right amount of nutrients that we need. And also when you're dealing with deficiencies, sometimes you need up to 7 times more nutrients just to get your levels back up to where they need to be. So we can't always eat that many calories. Plus, the nutrient levels in our food have been shown to be a lot lower than they were 100 years ago. So to get all your nutrient levels to the optimal health range, we often suggest supplementing when needed. So if someone's looking for a good quality magnesium supplement, what do you recommend that they look for?
Well, the first thing you always look for in any supplement is purity. There are so many contaminants in food and supplements today that it is actually quite alarming. And so magnesium is a mineral. Many supplements are contaminated out there with things like lead and cadmium. So you want to purchase a supplement from a company who obsesses about testing to guarantee there's purity in their product. Then the next thing I always say is look for a combo. There's different types of magnesium, and so look for a combo of one that is a magnesium citrate, magnesium glutamate, magnesium oxide. Those three are a good combo, and they are very readily used by the body when there's a good combination of different types of magnesium. And then the third thing that I believe is very important is you want to get a sustained release magnesium or a gel diffused, where it is released gradually over 4 to 6 hours, so that the body is getting a little bit at a time to maintain like the arrhythmia of the heart and the utilization of magnesium in your muscles, etc. It maintains more of a balance. So a released one, and therefore you would have less risk of having excess go to your bowel and cause a loose stool. So that's what I always recommend. And we certainly find that a lot of people who are constipated find that magnesium is of great benefit to them. Some people require twice as much magnesium as the next person does based on their constitution, etc. And so it's really important that they know that. And one other thing I always say to athletes, I'll say when they are perspiring a lot, they perspire out a lot of minerals in their perspiration, and you can lose a lot of magnesium when you're perspiring. So athletes might need to use extra because they've lost some.
Okay. So now we talked earlier about calcium and how important calcium was. And we also know that magnesium is very important to help with the proper absorption utilization of calcium. So I can see how it's very important for us to make sure that we get enough magnesium. I know certain people that have started making sure they had optimal magnesium, and their headaches would be greatly reduced. Constipation issues were corrected. They didn't have as much restless leg syndrome. There's so many different things that their body just worked much better because they made sure they had optimal amounts of magnesium. So yeah, it's wonderful for us to know how we can safely get this into our diets, and also what levels that we need to look for in our blood work to make sure that we actually are at optimal healthy ranges.
A lot of people say that they sleep better when they have more magnesium.
Yeah. It's known to help people relax, right? So.
And blood pressure is a big part of all of this. A lot of individuals, as they develop higher blood pressure, as they get older, they are very magnesium deficient, and magnesium causes a relaxation in the arteries. And so that's a very important thing for blood pressure.
Okay, great. So this is a supplement or a mineral that maybe has not been getting enough attention over all the years. Calcium's been getting all the attention. So now it's great that we're just kind of giving more of a balanced approach to proper mineral intake as well. So thank you so much, Martha, for your time. And I look forward to the next Minutes with Martha. Thank you, Martha.
You're welcome.